when the body shuts down, it usually shuts down because it cannot handle the emotional impact of a situation. Emotion is, after all, an assessment of whether the situation is favorable to us or unfavorable to us, not in the abstract, but how it feels in the body. That's why people come to us. So if we can find the important emotions in the body, and then, subject to clinical judgment, the therapist has to determine, using the theory that they have, which important is important in that particular situation, depending on their psychological theory that they bring to the situation. They find the emotion, and then they help the client to expand the emotional experience in the body consciously, that to ensure that as few places in the body are blocked from emotional experience, right? And then we can expect the therapy modality, whichever it is, whether it's cognitive work or behavioral work, can improve in outcomes. And this is what cognitive behavioral therapists are now finding out about. They also have access to the same set of scientific findings that I have access to. And eventually, the field is going more somatic. So they're also looking at it and bringing it in a little bit at a time. But we can go much deeper. And because we have the entire tradition of body psychotherapy behind us, right? So in terms of how to work with the differences of the body, that most therapy modalities have no idea about, because they don't pay attention to the body. They're looking at psychological defenses such as denial and compromise formation, etc. But constriction patterns in the body can be considerable, and it doesn't matter how long you do an analysis, if it is stuck there, unless you do something to open it up, you're not going to have access to the emotion, which means the body is not participating in the emotion, which means the brain is not processing the situation well. So it doesn't matter how much cognitive work and analysis you do, it's going to be suboptimal. Not that it's not effective, because we do know that all therapy modalities are effective, right? It's a matter of how degree to which they are effective, how fast can they change outcomes, how efficient it can be, and how regulated it can be. That is where the body's comes into play. And in the last 25 years, we have so much evidence that any modality that does not use the body in some way is going to be not providing its clients the standard of care that the science itself is implying that it needs to be. It needs to be there in terms of the involvement of the body. And we're going one step further. We're saying not just the body, not just dance around, move around, stretch around, but see whether the body is inhibiting itself or dysregulating itself in moments that matter emotionally, so that in those situations, the brain can function very much better. And we talked about different steps, right? I mean, we try to operationalize it in different ways. There are some steps where we work with other bodies, other levels of the body that is not in the first book. I'm writing about it now. So I'll say a little bit about it later. So today, and we saw a clinical example, demonstration of working with a woman's anxiety in relation to her boss, and how once she was able to process the fear in the body, she could get to a place where she could take the projection back. She could see that her reaction to the boss, even though the boss is not an exemplar of a person, there was some cause. That reaction she had that led to a shutdown and anxiety doesn't have to be there, because she could process the anxiety. She could clear it. She can, at least she might have it in future situations, but in this particular situation, it reduced and actually led to the improvement of the relationship between a boss and the person I worked with. Somehow people sense, when you change, other people sense too. So she stopped bullying her and so on. So there are 4 steps involved in terms of, the 4 steps are situation. One is situation. I'm just doing a review of last week. Situation is a situation that gives rise to the emotion. Now, sometimes people come in and they have no idea what the situation is. They're feeling awful or sad. Then it's okay. You're on step 2, emotion. Here, you have to make sure that you're working with them psychologically so that they're not denying that this is an relevant emotion. I shouldn't feel angry at anybody. My Buddhist Lama taught me that. Or um, or women shouldn't get angry. All these cultural and familial and psychological mechanisms one has to work with so that the person doesn't defend against emotion. And then the third step that's important is what is called expansion regulation. We need to be able to work with the body. Yeah. Different levels of the body, I would say, but I'm going to stick to work with the body right now without differentiating the levels of the body. Work with the defenses in the body so that the emotion can be accessed. Yeah. There are different ways of working with it. For example, breath therapists. Breath therapy has been used in body psychotherapy systems, also as an independent modality where people are lying on their back and breathing fast in the chest, which then tends to challenge the inhibition patterns in the chest against emotion. Then the people regress, they come up with emotions. This can be very powerful, right? Now, we can also use breath, but it's a little more complicated to teach talk therapists who have not worked with the body, how to use breath. So is there a simple way to do it? And I thought at the beginning, movement is the way to go. You can always counter it. Movement not only counters the inhibitions in the muscular system, but also in the autonomic nervous system and the central nervous system, right? It's through movement that we primarily mobilize energy. So inhibiting that inhibits emotion. But it's very difficult to get psychotherapists to move or to teach them how to move so that the movement itself is not a defense. Yeah. So what do? You end up. So I said, touch is great. Touch, therapists touch. People don't want to touch to be touched, and therapists don't want to touch their clients, especially in the US for different reasons. So why don't we invite clients to touch themselves in certain ways that are informed by osteopathy and other body work systems so that we can undo the defenses in different parts of the body to access the emotion as well as to regulate the body. You see, when you defend against emotion by shutting down, let's say, your breathing mechanism, yes, you inhibit emotion, but you also put your body at risk, biological risk, right? So when you access the fear, let's say, that's inhibited by the constriction here, you also breathe better, right? So that's why I call it expansion regulation. Breathing better increases the ability to actually stay with the emotion. Holding your breath actually paradoxically makes it harder to, to process the emotion. It blocks the emotion as well as blocks the ability to process the emotion. So it's expansion regulation is the third step, which is a very important step. And I've tried to make the body psychotherapy less complicated by simple hand positions that work for most people. Yeah. There are people who are so inhibited that they might need some deep work or exercise, yoga, to undo the defenses. For most people, it's not difficult. So in the expansion regulation stage, it turns out that we can also work with the subtle body defenses. See, Western psychology, pretty much following Western science or science, has eliminated all other levels of the body, and it works with the body. In fact, it reduces it to the neurons in the brain. So it's a very myopic model of the body. That's how it is. That's where the field is. So any way we can expand that to not only working with what the Easterners call the gross body, which is the body that is conceived in the womb and laid to rest in a tomb. But then there's a subtle body. The subtle body goes on, and we don't know where it goes. There's a lot of evidence that goes on, and even in out-of-body experiences, near-death experiences, there's a clear presence of a person with continuity of memory and all the psychological experiences, except that they cannot connect it to the body on the table that the doctors are trying to, resuscitate, right? So it turns out in Eastern psychology, there's a lot, going back thousands of years, there's a lot of knowledge about what are the layers of this body. Just like we have the muscular system, we have the visceral system, we have the central nervous system, the subtle body anatomy is laid out through, by Eastern phenomenologists who are interested in exploring themselves. Yeah. And so there's a great map of it. And there are several maps of it. So the key is to find an easy enough map that we can work with very quickly to bring about change. Yeah, to bring about facilitate change, because the brain controls at the gross level. The brain controls the body, but in the relationship between the subtle body and the gross body, the subtle body controls and regulates the gross body. But in fact, when it leaves the gross body for a long time, the gross body starts to die. Right? Life, it's the source of all stimulation, physiological and emotional. But itself, when attached to the gross body, suffers, and then it forms defenses. So it's sometimes easier to work with the gross body and the subtle body at the same time. In order to do that, we need to have no subtle body techniques, and the thing is, there's a lot of ignorance out there, and therefore people don't use it. However, please remember that no body psychotherapy has been approved by the APA for trauma work or any other work. They have approved an energy psychology method called thought field therapy or emotional freedom technique. These two systems have been approved for nearly 10 years, 10, 12 years. Why? Because by a simple tapping of the certain meridian points, they don't know where it came from. The founder of the system, thought field therapy, said that he learned it from the East, but he wouldn't say where he learned it from. Fear of competition, I guess. But it's a very effective method for down-regulating post-traumatic stress. It's approved for treating post-traumatic stress. So forget the map of the body. But if somebody comes to you and says, here's a technique, use it, control group, treatment group, or cognitive behavioral therapy, and you end up using this technique and you get much better results that persist in the long run, you have to take it seriously. Psychology takes that seriously. And that's why the American Psychological Association couldn't say no. Could not say no. And it's beating cognitive behavioral therapy in terms of trauma treatment, right? And it's limited in that it's all about down-regulation of primary symptoms of trauma, intrusion, arousal, and avoidance. That's fine. That's fine. Child soldiers in Africa don't care where the technique comes from, right? It works. And so the model of the subtle body, I use a little more sophisticated. Yeah, it has layers, it has resources, and so on. And we can not only use the resources of the subtle body and undoing the differences in the subtle body, but we can also connect the individual bodies to the collective bodies. It turns out that we have two collective bodies because an apparent sense of separation of this body or the subtle body with the rest of the universe is actually only apparent. Quantum physics and neuroscience is now very much on this, at the edge of both disciplines. The boundary is a boundary of an individual body or sense of self, etc., is a neurological fiction. Yeah, but we do have to assume that and to work with the clients, right? We have to assume that.